guys, welcome back to the Pharmacotherapy series on Pharma Palette. What if I told you that a disease with absolutely no symptoms could silently lead to heart attack or stroke? Sounds scary, right? That's exactly what hyperlipidemia does. Most people don't even know that they have it until a serious complication develops. But don't worry, today's video I'm going to make this topic super easy with simple flowcharts, memory tricks, and exam oriented points. So, we will be learning what hyperlipidemia is, why it occurs, how it causes the heart attack and stroke, signs and symptoms, diagnosis, along with certain lifestyle modifications. So, let's get started. So coming back to the definition of hyperlipidemia. So what is hyperlipidemia? The name itself says hyper means increase, lipidemia means increased lipids in the blood. So simply if there is a elevated levels of lipids, so lipids can be cholesterol or the triglycerides. If these levels are getting increased in the blood, so that condition is called as hyperlipidemia. So this is one of the common form of the this dyslipidemia. So dyslipidemia means it is simply the abnormal levels of lipids in the blood. So usually what happens? These lipids, they are insoluble. As they are insoluble in the blood, they will be circulating and attaching towards the proteins. So those proteins are called as lipoproteins. So coming back to the types of this hyperlipidemia, there are two main types. One is hypercholesteremia and second one is hypertriglyceridemia. So in the hypercholesteremia, the name itself says hyper means increase, cholesteremia means increased cholesterol levels. So if there is any elevation or increase in the blood cholesterol levels, that condition is called as hypercholesteremia. So this is usually associated with the elevated LDL levels. And coming to the second type, hypertriglyceridemia. So here increase in the blood triglycerides. So if the triglycerides in the blood gets increased, that leads to the condition called as hypertriglyceridemia. So here it is usually associated with the increased VLDL levels in the blood. So coming back to the causes of hyperlipidemia with one super easy memory trick. So let's go. So just remember the mnemonic Dana Dapasa, where D means it is diet, diet which is rich in fats. H means it is hypothyroidism. A means it is anorexia nervosa. N means it is nephrotic syndrome. O means it is obesity. O means it is obstructive liver disease. D means it is diabetes mellitus. P means it is pregnancy. A means it is acute hepatitis. S means it is SLE, which is systemic lupus erythematosus. A means it is AIDS. So coming back to the pathophysiology of hyperlipidemia. So what happens if a person takes high fat diet, or if he takes excess sugar and alcohol intake, or if there is a lack of exercise? So if there is any of these three, the fat levels in the body gets increased, especially the cholesterol production in the liver will be getting increased. At that condition, the lipids like cholesterol and triglycerides in the blood will be increased. That will be leading to the increased blood cholesterol in the body. When the bad cholesterol gets increased, especially the LDL levels, so they will be starting deposition on the artery walls. When when this LDL cholesterol is getting deposited onto this artery walls, it will be leading to the plaque formation. Plaque means simply the formation of atheroma. So when the atheroma is formed, it will be leading to the atherosclerosis. So what happens in the atherosclerosis? There will be narrowing of the arteries. When the arteries get narrowed, the blood flow will be not proper. It can't flow properly. So due to which the blood flow gets reduced. That will be further leading to the conditions like angina, MI and stroke. Till now what we have discussed is the LDL pathway. We also have the HDL pathway. So HDL you already know that HDL is a good cholesterol. So what it will do? It will be removing the excessive cholesterol which is deposited in the arteries. So when it removes the excessive cholesterol from the arteries, then it will be returning back to the liver. Once it reaches the liver, it helps to protect against the atherosclerosis. So coming back to the signs and symptoms, usually if the patient has hyperlipidemia, usually in the beginning there will be of asymptomatic, there will be no symptoms seen. The symptoms only appear after the complications, only after complication. Like if a patient has angina or MI or stroke, at that condition you'll get to know that there are some symptoms, but till then it is asymptomatic only. So you can't see any symptoms until the damage occurs. So coming back to the diagnosis, a simple blood test will be done where you'll be detecting the lipid profile. So from that lipid profile you will be taking the fasting blood test. So at least the patient should be in 10 to 12 hours of fasting to know the cholesterol levels. So fasting lipid profile test will be performed, which is a simple blood test where you'll get to know the total cholesterol, LDL cholesterol, HDL and the triglyceride levels. So coming back to the non-pharmacological treatment, which generally includes the lifestyle modifications. So here in this condition, just remember the trick as WESHD, where W means it is the weight control, E means it is following regular exercise, S, S is to stop smoking, H means is to follow the healthy diet. So that diet should mostly have the fiber content, and D means drugs if needed. So if even after doing all the lifestyle modifications, if you can't see any improvement in the symptoms, at that condition, the pharmacological treatment can be used. So that's all for the part 1 of hyperlipidemia. So we covered what hyperlipidemia is, its types, causes, pathophysiology, signs and symptoms, diagnosis and the lifestyle modifications. But the most important part is still coming. In part 2, we will simplify the complete pharmacological therapy of this hyperlipidemia, including the drug classes, mechanism and their treatment algorithm along with certain indications. Everything which we will be discussing with flowcharts and memory tricks that help you remember everything during your exams. So make sure you don't miss it. And before you go, remember this, don't study to pass the exam, study to understand. Marks will follow, but knowledge will stay with you forever. So see you all in the next video. Thanks for watching.